Imagine waking up at 3 in the morning with that burning sensation climbing up your chest, that acidic taste in your mouth, that feeling of fire in your throat. You reach for the antacids on your nightstand again, knowing this will be another sleepless night. You remember when you could eat dinner and sleep peacefully, when food was enjoyable instead of something to fear. That constant worry about what you eat, that anxiety every time you sit down for a meal, wondering if this will be the food that ruins your night. I am Dr. Grace Nakamura, a board-certified gastroenterologist with over 10 years of experience treating patients specifically with heartburn, gastroesophageal reflux disease, and chronic digestive disorders. As a medical specialist, I see hundreds of patients every month who are suffering unnecessarily because they are eating foods they believe are healthy, when those exact foods are destroying their esophagus and triggering severe nighttime reflux. Today I am going to reveal 5 specific foods that actually help heartburn, with scientific explanations of exactly how each one protects your esophagus, reduces acid production, and promotes healing. But I am also going to warn you about 2 extremely common foods that millions of Americans eat every single day, foods that are marketed as healthy, foods that trigger devastating overnight heartburn that can lead to serious complications. These 2 trigger foods are probably in your kitchen right now, and eliminating them could be the single most important change you make for your digestive health. Before we begin, if this content can help you finally understand what is causing your heartburn and how to fix it, leave your like down below. And if you want to receive reliable medical information about digestive health every week, subscribe to the channel and turn on notifications. Your health matters, and we are going to take control of it together. Now let us get to what really matters. The first healing food is oatmeal, but only if you prepare it correctly, because the wrong preparation can actually make heartburn worse. Oatmeal is not just a breakfast food, it is a therapeutic food with specific properties that protect your digestive system. Oatmeal contains beta-glucans, which are soluble fibers that form a protective coating over the lining of your esophagus and stomach, acting like a natural shield against corrosive stomach acid. These beta-glucans also bind to bile acids in your intestines, reducing the amount of bile that can reflux back into your stomach and esophagus. Bile reflux is often overlooked, but it is a major contributor to nighttime heartburn symptoms. Oatmeal has a pH of around 6.5, which is nearly neutral, so it does not stimulate excess acid production the way acidic foods do. The complex carbohydrates in oatmeal are digested slowly, providing steady energy without causing blood sugar spikes that can trigger acid production. Oatmeal also absorbs excess stomach acid like a sponge, physically reducing the amount of acid available to reflux into your esophagus. In my practice, I recommend preparing oatmeal with water, not milk, because whole milk can increase acid production in some people due to its fat content. Cook half a cup of steel-cut oats or rolled oats in 1 cup of water for 5 minutes. Let it sit covered for 2 minutes, and eat it warm, but not hot. You can add a teaspoon of raw honey for natural sweetness, but never add sugar, cinnamon, or fruit in the beginning stages of treatment. Eat this oatmeal for breakfast every single morning, 30 minutes after waking up. This simple habit creates a protective environment in your digestive system that lasts for hours. Patients who follow this protocol consistently report a 40 to 60% reduction in daytime heartburn symptoms within 2 weeks. The second healing food is bananas, but they must be ripe with brown spots on the peel, because underripe bananas can actually irritate your stomach. Ripe bananas are one of nature's most effective natural antacids, with properties that few people understand. When bananas ripen fully, their starch content converts to natural sugars, and their pectin content increases significantly. Pectin is a soluble fiber that forms a gel-like substance in your stomach, coating the lining and protecting it from acid damage. Ripe bananas have a pH of around 5.6, which, while slightly acidic outside the body, becomes alkaline during digestion, helping to neutralize excess stomach acid. Bananas contain natural antacid compounds, including protease inhibitors that reduce stomach acid secretion. They also stimulate the production of mucus in the stomach lining, thickening that protective barrier between your tissue and the acid. Bananas are rich in potassium, which is crucial for proper function of the lower esophageal sphincter, that muscular valve that prevents acid from flowing back into your esophagus. When potassium levels are optimal, the sphincter closes more effectively. Bananas also contain compounds that promote healing of damaged esophageal tissue, accelerating recovery from acid burns. In my clinical experience, I recommend eating one ripe banana 30 minutes before each main meal, particularly before dinner. This preloads your stomach with protective compounds before food and acid production increase. The banana should be eaten slowly, chewed thoroughly, until it becomes almost liquid in your mouth. This maximizes the coating effect on your esophagus as it goes down. Never eat green or yellow bananas without brown spots if you have active heartburn, because the higher tannin content in unripe bananas can irritate inflamed tissue. Never eat bananas with other foods. Eat them alone as a pre-meal treatment. This simple strategy has helped countless patients reduce their nighttime reflux by giving their digestive system natural protection before the evening meal. The third healing food is steamed or baked sweet potato, which is a powerhouse of nutrients that specifically support digestive health and reduce acid production. Sweet potatoes are often overlooked in heartburn treatment, but they have remarkable therapeutic properties. Sweet potatoes are alkaline-forming foods, meaning that while they have a slightly acidic pH of 5.3 when raw, they produce an alkaline effect in your body after digestion, helping to balance excess acidity. They contain high levels of vitamin A in the form of beta-carotene, which is essential for maintaining healthy mucous membranes throughout your digestive tract. These mucous membranes are your first line of defense against stomach acid. Sweet potatoes are rich in soluble fiber that slows digestion and prevents the rapid stomach emptying that can trigger reflux. They contain vitamin C, which supports collagen production necessary for healing damaged esophageal tissue. Sweet potatoes have natural anti-inflammatory compounds, including anthocyanins and phenolic acids, that reduce inflammation in your esophagus and stomach lining. They provide complex carbohydrates that are digested slowly, preventing blood sugar spikes that stimulate excess insulin and subsequently excess stomach acid production. The texture of properly cooked sweet potato is soft and easily digestible, requiring minimal stomach acid for breakdown, reducing the overall acid load in your digestive system. To prepare sweet potato therapeutically, wash a medium sweet potato thoroughly, pierce it with a fork, and bake it at 350 degrees Fahrenheit for 45 minutes until very soft. Alternatively, peel and cube a sweet potato and steam it for 15 minutes until tender. Eat the sweet potato plain, with no butter, no oil, no salt initially. You can add a tiny amount of olive oil after the first week if your symptoms have improved. Eat half a medium sweet potato as part of your lunch or as an afternoon snack. Never eat sweet potato for dinner if you have nighttime reflux, because any carbohydrate eaten late can sit in your stomach overnight. This timing is critical for results. The fourth healing food is skinless chicken breast, but it must be prepared without fat and eaten in the correct portion size. Lean protein is essential for healing your digestive system because amino acids are the building blocks your body needs to repair damaged tissue. Chicken breast is one of the lowest fat protein sources available, and fat is a major trigger for heartburn because it slows stomach emptying and relaxes the lower esophageal sphincter. When you eat high-fat meals, food sits in your stomach for hours, fermenting and creating pressure that forces acid up into your esophagus. Chicken breast has virtually no fat when the skin is removed, making it ideal for heartburn sufferers. It provides high-quality complete protein with all essential amino acids needed for tissue repair. Chicken breast contains vitamin B6, which supports proper digestive enzyme function and helps metabolize proteins efficiently. It provides niacin, which improves blood flow to the digestive tract, supporting healing. The texture of properly cooked chicken breast is firm but tender, easy to digest without requiring excessive stomach acid. Chicken breast is neutral in pH, around 6.5, so it does not stimulate acid production. In my practice, I recommend eating a palm-sized portion of skinless chicken breast, which is approximately 4 ounces or 100 grams, for lunch. Never eat chicken for dinner if you have nighttime reflux, because protein takes 4 to 6 hours to fully digest. The preparation method is absolutely critical. Bake, grill, or poach the chicken with no added fat. Season only with herbs like oregano, thyme, or rosemary, never with pepper, chili, or acidic marinades. Cut the chicken into small pieces and chew each bite at least 20 times before swallowing. This pre-digestion with saliva reduces the work your stomach must do and minimizes acid production. Many of my patients report significant improvement in symptoms simply by switching from red meat or pork to properly prepared chicken breast. The fifth healing food is steamed or boiled vegetables, specifically carrots, zucchini, green beans, and spinach, but never raw vegetables if you have active heartburn. Cooked vegetables lose the tough fiber that causes gas and bloating, while retaining vitamins, minerals, and healing compounds. Raw vegetables require significant stomach acid and mechanical digestion, stressing an already inflamed digestive system. Cooked vegetables are pre-softened, requiring minimal digestive effort. Carrots contain beta-carotene that converts to vitamin A for mucous membrane health. They have pectin that forms protective gel in your stomach. Zucchini is extremely low in acid, with a pH of 6.2, and contains anti-inflammatory compounds that soothe irritated tissue. Green beans provide gentle fiber that promotes healthy bowel movements without causing gas. Spinach is rich in chlorophyll, which has alkalizing properties and supports tissue healing. All of these vegetables are low in natural sugars, preventing fermentation and gas production that increases stomach pressure. To prepare these vegetables therapeutically, wash them thoroughly, cut them into bite-sized pieces, and either steam for 10 to 15 minutes or boil in water until very tender. Never add butter, oil, or cream sauces. Season only with a tiny amount of sea salt and herbs. Eat 2 cups of mixed steamed vegetables with lunch and dinner. Vegetables should comprise half of every meal when you are healing from heartburn. The high water content of cooked vegetables also helps dilute stomach acid naturally. Patients who increase their cooked vegetable intake while eliminating raw vegetables typically see 30 to 50% improvement in symptoms within 1 week. Now we come to the 2 trigger foods that cause devastating overnight heartburn, and I need you to pay very close attention because these foods are probably causing your worst symptoms. The first trigger food is tomatoes in any form, including fresh tomatoes, tomato sauce, ketchup, salsa, and tomato juice. Tomatoes are one of the most powerful heartburn triggers that exist, yet they are in everything we eat. Let me explain exactly why tomatoes destroy your esophagus. Tomatoes have a pH of 4.3 to 4.9, which is highly acidic. This acidity directly irritates already inflamed esophageal tissue, causing immediate burning pain. Tomatoes contain citric acid and malic acid, both of which are corrosive to sensitive digestive tissues. They also contain a compound called tyramine, which stimulates stomach acid production. When you eat tomatoes, your stomach responds by producing even more acid, creating a cascade effect that leads to severe reflux. Tomatoes are also high in natural sugars that ferment in your stomach, producing gas that increases pressure and forces acid upward. The combination of acidity, acid stimulation, and fermentation makes tomatoes a triple threat for heartburn. Tomato products are particularly dangerous when eaten in the evening, because they sit in your stomach for hours overnight. I have seen countless patients who could not understand why they woke up at 2 or 3 in the morning with burning pain. And when we reviewed their food diaries, they had eaten pasta with tomato sauce for dinner, or pizza, or Mexican food with salsa. One memorable case was a 55-year-old woman who had severe nighttime reflux for 3 years, taking maximum dose proton pump inhibitors with minimal relief. She was eating a salad with fresh tomatoes every single night for dinner because she thought it was healthy. When we eliminated all tomatoes from her diet completely, her nighttime symptoms resolved by 80% within 2 weeks. She could not believe that such a simple change had such dramatic results. If you have heartburn, you must eliminate all tomato products completely for at least 8 weeks while your esophagus heals. This means no pasta sauce, no pizza, no ketchup, no salsa, no tomato soup, nothing with tomatoes. After 8 weeks, if your symptoms have resolved, you can try reintroducing a small amount of cooked tomato with lunch, never dinner, and monitor your response. Many of my patients find they can never tolerate tomatoes again without triggering symptoms, and they accept this because the relief from eliminating tomatoes is so profound. The second trigger food is chocolate in any form, including dark chocolate, milk chocolate, white chocolate, chocolate desserts, hot chocolate, and chocolate-flavored anything. Chocolate is absolutely devastating for heartburn through multiple mechanisms that most people do not understand. Chocolate contains a compound called theobromine, which is a methylxanthine similar to caffeine. Theobromine directly relaxes the lower esophageal sphincter, causing it to open when it should be closed, allowing acid to flow freely from your stomach into your esophagus. This relaxation effect lasts for several hours after eating chocolate. Chocolate also contains caffeine, which stimulates stomach acid production and also relaxes the lower esophageal sphincter. Chocolate is high in fat, particularly saturated fat, which slows stomach emptying dramatically, leaving food and acid in your stomach for extended periods. This prolonged stomach fullness increases pressure and promotes reflux. Chocolate triggers the release of serotonin in your digestive tract, and while serotonin is a feel-good neurotransmitter in your brain, in your gut, it relaxes smooth muscle, including the esophageal sphincter. The combination of theobromine, caffeine, fat, and serotonin makes chocolate perhaps the single worst food for heartburn. Eating chocolate in the evening virtually guarantees nighttime reflux in susceptible individuals. I have had patients who eliminated everything else but held on to their nightly piece of dark chocolate because they heard it was healthy, and they continued suffering. Dark chocolate is marketed as a health food because of its antioxidants, but those benefits are completely irrelevant if it is destroying your esophagus every night. One patient, a 48-year-old man, had been eating 2 squares of 70% dark chocolate after dinner every night for years. He had chronic cough, hoarseness, and nighttime choking sensations. Multiple doctors had treated him for asthma and allergies with no improvement. When I did a pH monitoring test, it showed massive acid reflux every night, starting about 2 hours after he ate the chocolate. We eliminated the chocolate completely, and within 3 weeks, his cough resolved, his voice returned to normal, and he stopped waking up choking. He was amazed that something he considered a small, healthy treat was causing such severe symptoms. If you have heartburn, you must eliminate all chocolate completely. There are no exceptions, no small amounts, no special occasions. Chocolate and heartburn cannot coexist. After your esophagus has completely healed, which takes at least 8 to 12 weeks of perfect compliance with all recommendations, you might be able to tolerate a tiny amount of chocolate, occasionally with lunch, never dinner. But many people find that even small amounts trigger symptoms, and they choose to avoid chocolate permanently because their quality of life without heartburn is worth more than a moment of chocolate pleasure. I need to pause here and ask you something important. How many nights per week do you wake up with heartburn? 1 night? 3 nights? Every single night? As a gastroenterologist who specializes in reflux disorders, I understand how devastating chronic nighttime heartburn is for your entire life. Your sleep quality, your energy during the day, your ability to focus at work, your mood, your relationships, everything suffers when you cannot sleep through the night. Heartburn is not just an inconvenience. It is a medical condition that deserves proper treatment, and you deserve to sleep peacefully without that burning pain. I want you to write in the comments, "I wake up with heartburn X nights per week," and fill in your reality. Do not be embarrassed. Your honesty helps other people feel less alone and helps build a supportive community. I read every comment because every person suffering from this matters, your experience matters, and your recovery is possible. Now let me give you the complete protocol for the next 8 weeks, because consistency is everything. Do not try to implement everything at once, or you will feel overwhelmed and quit. We go step by step, building sustainable habits. In week 1, your only goal is to eat oatmeal for breakfast every morning and eliminate all tomato products. That is it. Nothing else changes yet. Give your body 7 days to adapt to these changes. In week 2, add 1 ripe banana 30 minutes before lunch and dinner. Continue the oatmeal and no tomatoes. In week 3, eliminate all chocolate completely and add steamed sweet potato to your lunch. In week 4, replace any red meat or pork with skinless chicken breast for lunch only. In week 5, add 2 cups of steamed vegetables to both lunch and dinner. In week 6, stop eating anything after 6 p.m. and go to bed no earlier than 9 p.m., ensuring at least 3 hours between your last food and lying down. In week 7, elevate the head of your bed 6 to 8 inches using bed risers under the legs, not just pillows. In week 8, evaluate your symptoms honestly. If you have improved by 50% or more, continue this protocol for another 2 months to allow complete healing. If you have not improved significantly, you need in-person medical evaluation, because there may be underlying conditions like hiatal hernia, severe esophagitis, or Barrett's esophagus requiring additional treatment. As a gastroenterologist who has spent years helping patients with chronic heartburn, I understand your frustration when nothing seems to work, when medications only mask symptoms temporarily, when you feel hopeless about ever feeling normal again. I created this channel specifically to share reliable medical knowledge, evidence-based protocols, and strategies that actually work in real clinical practice. Every week I upload new content about digestive health, natural treatments validated by science, and practical tips you can implement immediately. If this video helped you understand which foods heal heartburn and which foods trigger it, subscribe to the channel and turn on notifications. We are going to take care of your digestive health together, safely and effectively. Remember that your well-being matters, and you deserve to live without the constant suffering of heartburn.